Tanya, and good morning, everybody. Um, let's say we are happy to be here, and it's good to start by acknowledging our partnership between KNBS, FSD Kenya, and now we have expanded the group so that at least you're able to get more insights on this particular index that we want to develop. Maybe in terms of introduction, all of us are aware that the new government have come in, and one of the major issues that everybody have heard about the new government is trying to do the issues of financial inclusion. You hear every day our president talking about CLB listing. The other time you hear about debt distress. Other time you hear access to finance for MSME. So, and to crown it all, the father of financial inclusion, Professor Jogona, has now been elevated to CS, National Treasury, meaning the issues of financial inclusion will be given more prominence in this particular regime. So we have to be so sure on what we are supposed to produce, at the same time, what is the indicators that we are giving. So we don't have a major presentation. For what we want to just preempt before we come to technical discussions on how the index is computed. Paul will talk about the weights, the robustness of this particular index, and then you'll tell us whether does it make sense, should we include this particular indicator or not. It's good to highlight some of the issues that maybe, which can be the guiding principles that will assist us in this particular presentation. So maybe we can start by asking ourselves, one of the major questions that we have is that we know the access of financial inclusion is high. Like Chilonga have said, currently we are around over 80%. And last time we said that, is it true that we have reached saturation? But the key point is that access is not an issue. Like Chilonga have said, when I participated in Alliance of Financial Inclusion Global Forum, there were these major discussions about the issues of financial health. And I was surprised to hear that majority of the people are quoting Kenyan numbers. And they were saying the financial inclusion for Kenya is so high at 83, but financial health is so low, below 20%. So it means that as people access financial inclusion, are they becoming better? That's the big questions that we have. And since we focus most of the time on the formal financial services, is Kenyans having a better quality life as we expand the financial inclusion space? From analysis and from the empirical evidence, all of us agree on these particular issues that I've listed there, from empirical evidence that as long as people increase the access to financial services, at least there is high possibility of reducing poverty, that is extreme poverty, at the same time issues of inequality. That is what we expect to get from access to financial services, and the other issues of increased investment and saving, and the other issues of solving the problems of gender gaps, and the same times other types of inclusion gap. At the same time, we have other issues that are coming up, issues like climate change, sustainable, inclusive growth. So those are the aspirations that every regulator wants to have as we advocate for financial inclusions. Now, the biggest question is, Kenya, we are at that high. Are we able to achieve all this? And one of the ways to measure this is through the what we want to discuss this particular week, the financial health of our Kenyans. So you can go to the next slide. So this is the picture that Paul will share with us sometimes later in other presenters. And then, like I iterated earlier, we are there from 26% from 2006, and now we are at 83 or 84% in terms of access. But from 2016, since we started measuring financial health, we have been declining, and you can see the fall is deep and steep. I don't know whether if we continue the way we are, whether the next survey will give us a 10% or maybe 9%. So what we want to spend some time on this particular workshop is try to interrogate our measure, because we don't know whether the reasons why the financial health is declining, is it the policy problems that we have, whereby already we know from our studies that cost A lot of access to financial services in terms of affordability is a problem. There are so many issues about market conduct from this particular access. There are a lot of issues of debt. Debt levels have gone up. There are a lot of issues of gambling. There are a lot of issues of financial stress that will be brought by access to financial services. If my brother or my son, or even me, I didn't have mobile money, there is a possibility of not participating in gambling because I don't go to casinos. But since I have a mobile phone, there is a possibility. And there was a study, FSD, they did, they told us that immediately somebody's bought some funds, this betting company said you are an SMS. You can win this. And you are tempted to, as much as possible, to do those particular betting. So what we are saying, these market conduct issues, have they been elevated because of we have a lot of access? Now for technical issues like us, we have to ask ourselves, or is it that the way we are measuring financial health, we have some elements or some numbers that we have not included? Do we have some all coverage indicators that we can use to measure financial health? And based on the discussions that I held at the AFI Global meeting, there are some countries that were putting more indicators in terms of things that we don't know, but Paul will guide us later about the confidence in financial system. Even when you come to technical analysis, we do some issues with weights. Like Amlik later will tell us that in this financial health, people from the northeastern side, they are depicted to be more financially healthy compared with us who are involved in agriculture because of inclusion of some of the indicators that we have, like savings in livestock. So do we have a problem with weights and even in terms of thresholds? Is it that we are too ambitious that we have said, if you don't meet this particular threshold, you will not be considered to be financially healthy? So these are some of technical discussions that we'll have as we go ahead. But for policy problems like cost, market conduct issues, we cannot solve them in this particular workshop because that requires other set of helmet that we are supposed to wear. But for now, we are wearing the helmet of the measurement problem. We can go on. I got this from Deloitte, who are trying to put pictorial presentations of the issue to do with financial health. And they are talking about the iceberg and telling us about what we can only see at the top of the tip is the issues of access, which is not an issue. Usage, we know people use mobile money, use the banking services, that is not an issue. And some aspect of quality in terms of system downtime, in terms of maybe cost. But the big thing that is we cannot see, which we can only measure maybe from the index, is the financial health status, which we say is ultimate goal that we want to have. As much as possible, we have this particular financial inclusion policy. As much as we encourage people to access, as much as we encourage people to use, what is the issue? Are we improving their financial health status? That is the issue. And you can see all of it is deep. Just like usually here, that if you put the tallest mountain in the world, the tallest mountain in the world is called what? Everest. People say that if you put the entire Everest at the deepest sea, at the deepest end of the sea, you'll not even see the Mount Everest. It seems that the issues that we cannot see, they are deep. So these are the issues that we'll try to see whether we can truly see that we have positive outcomes for all the lives. We can go on. So generally, the policy issues that mostly comes to our mind that we try to see whether we can capture in our index is to do with whether consumer protections issues that we mentioned along the way, whether how can we somehow capture them well. All of us know about financial FinAccess statistics. I'll not go to them for all of them, but at least we know we have consumer protection issues, system downtime, flood of money, loss of money, that one we have. We know we have market conduct issues, but at the bank we have tried as much as possible. These days when you're sending a mobile money, you are given first the cost. So it is an achievement that we're trying to reduce these unclear charges. and even terms of transactions. Even though we do mobile borrowing and then we are told, do you agree to these terms and conditions? Majority of us even click and say, without even reading these terms and conditions. But at least we should summarize, at least one of us all know. And the other interesting thing that we would like to have, which is still a good measure of financial health, is in terms of trust in financial sector. Interestingly, a majority of people, about 2.9%, that is approximately 3% from FinAccess, they are only people that trust advice from formal financial institutions. Meaning, even if you want to make a decisions, you can only 3% trust formal financial institutions. And majority of us here, we are from formal financial institutions, meaning 3% of Kenyans, only 3% of Kenyans can trust us when we come to guiding them in terms of financial advice. So it is not a good thing that we can boast of. It means that there is something that we are not doing well. While majority of people rely on themselves and limited information, limited financial literacy, limited advice. So if almost 90% they are relying on non-formal financial services, it's not a good thing. So these are some of the issues that we need to address in terms of policy. And even from the index, whether we can have a proxy that track this. Is the trust in financial system going up? We can continue. And in terms of the consumer education, I know Lynette, when we are trying to form the MTP4, she was so passionate about consumer educations and in terms of financial literacy, which is a key pillar in the MTP4, whereby we want to make a financial sector consumer protection framework covering all the subsector. And at the same time, each and every regulator will have their own consumer protection issues. Because if only 3% of people trust the form of financial services, it has some issues with the consumer educations, because maybe they don't know where they can get this knowledge to make decisions. Issues of debt distress, we don't have to reiterate them. All of us understand what we mean. And from FinAccess survey, which I know all of us have interacted with it, almost 50% of people were experiencing financial distress. That is at 46%. And majority of this distress is coming from maybe they were given access to credit, which they cannot afford because of financial inclusion, because you have mobile money and they're able to borrow from all these kind of money lenders, the Shylocks and all those kind of, I think the Shylocks that in formal space or in digital space. So maybe Paul and others, when we are discussing, we'll try to see, can we have an indicator that is supposed to proxy the debt payment or the debt management indicator, such that we're able to track this, because these statistics are not interesting, where we say almost half of all the borrowers somehow experience the debt distress. We may attribute this to COVID-19, but COVID-19 is not there, and still we are complaining about the debt distress. Affordability, there is nothing I can mention there, because all of us know that sending M-Pesa is expensive. It is good to admit that. When you want to send money through your mobile account, it's expensive. But since we don't have any alternative, people are still stuck with M-Pesa. But the other day, like I told you, in this new government, financial inclusion is an issue. You saw our president making an impromptu or an invited appearance in a meeting between Safaricom and the partners when they were trying to lower the Fuliza accessibility cost. So affordability is still an issue. But I know this one can be, that is within the purview of the regulators. That is something that we are not proud of. We should try as much as possible to do that. And at the same time, we encourage our legality. So can we still have an indicator to measure the affordability aspect? So those are discussions we'll have. So as I move to conclusion, what are the other, as we think about the index that we are constructing and the issues that we have raised, it is not that we as the policymakers and the same time privately, we should be only concerned on the measurement aspect. And so that because this index is something that keep moving, it is something that is in development from day one, continuous development, it's good to have an index that considers the development that is taking place. We are ambitious from NTP4 to have consumer financial laws and regulations, and it is so clear that what we're supposed to achieve so that we can solve the issues that are already listed up. And then this one I may not comment, but on terms of financial inclusion strategy or financial well-being strategy, this is something that we're supposed to have a framework to guide us. So as the regulators and CBK should take a leadership role on try to develop this. So even though we are developing this index, we have to have a way to track a movement toward this. And even the issues of solving the other aspect I've talked about, like a cost, CBK is taking a very big load in terms of reducing the cost. The other day you had the launch of Till is Till, so interpolability of payment system. And I know FSD are very passionate on this, and they are driving this, and they have invested a lot in trying to make sure that we have interpolability. So, and even in terms of encouraging the private sector who are here with us from banks to have as much as possible products that solve our issues, which are affordable, easy to use, promote investment and savings. So those are things that we need to keep encouraging. And lastly, the reason why we are here is good to consider whether we can broaden our mission for financial health. Because I sincerely don't believe that we are doing that badly at 17%. There must be something which we made, which we are not capturing, but this is why we are here. So I think that is the end of the presentation, and it's good to mention that we had a very wide coverage of financial health, and like you had, the whole world is watching us. So the number that we put, we must be right, just like we are right in terms of financial inclusion. And I wish you all fruitful discussion and deliberations, and I thank you so much for listening to me. Thank you.